As a victim of childhood sexual abuse myself, I know the psychological and emotional damage it causes, not just at the time, but in the years that follow, long after the abuse may have stopped. Since I formed the Lantern Project in 2003 with fellow survivor David Williams, we have worked with hundreds of other victims, both male and female, who have told us what happened to them and how difficult they have found it to disclose that to others in order to get some help in dealing with the consequences of the abuse they suffered. What we have learned from listening to these disclosures and also from our own experiences convinced us that if we are to help adult victims of childhood sexual abuse escape from their torment and build a sustainable recovery, there needs to be a fundamentally different approach than that currently offered by counsellors and therapists working in the NHS, which are normally accessed through one's GP. That is not a criticism of the excellent work done by the many counsellors and therapists, both in the NHS and those working privately, who help people recover from a wide range of disorders, such as general anxiety disorder, for example. But it is a recognition of what works and what doesn't work when dealing with the more complex nature of the psychological problems that emerge in adult victims of psychosexual trauma, which is what child sexual abuse really is.
There comes a time in the life of the victim when they simply can't cope anymore with the way they feel, and they reach a crisis point. There are many reasons why this happens. It may be the loss of a loved one, or an incident that brings back the memories of the abuse. Memories they have tried hard for years to bury deep in their subconscious. It might be because they can no longer face the problems caused by the coping strategies they have relied on to hide the pain of the abuse, such as alcohol and substance misuse, or other addictions and self-injurious behaviour. Whatever the trigger is, it is usually at this point that the victims begin to display symptoms of depression and post-traumatic stress disorder. But due to the deeply rooted cause of the problem, it is almost impossible for them to recognise or understand the links between how they feel now and what happened to them many years previously. Helping them understand these links and recognise the true extent of the harm they have suffered is very difficult to do unless you are able to break down the problem into manageable pieces, recognising and then dealing with each problem in turn, until a full picture of what has happened and how it has impacted on them emerges. The model that we have developed to guide victims through this process is called Unstructured Therapeutic Disclosure, or UTD for short. So what is UTD and how does it work? Imagine, if you will, for a moment that you are sitting next to someone you know well and respect, someone you believe also knows you and respects you. If I were to ask you to try and explain to that person the best sexual experience you have ever had, you would probably feel very uncomfortable. Now imagine how you would feel if I asked you to explain to someone you had never met before the worst sexual experience you had ever had. You would find that even more difficult. In fact, you would probably not want to explain anything in either of those scenarios, and certainly not the latter one. So when you go and see your GP because you can't cope anymore, you are faced with the latter scenario, which is why most victims who go to their GP tend to come away with antidepressants, because they have not been able to tell the doctor what the problem really is. Either because they don't fully understand themselves, or they are too frightened to disclose the details of the trauma they have experienced, either through confusion, guilt, fear, or shame, or the combination of all four. There are 5 essential elements needed to build a sustainable recovery from childhood sexual abuse: disclosure, acknowledgement, understanding, reconciliation, and healing. But while there is a natural progressive sequence to these 5 elements, it is not necessary for them to be achieved in any particular order, particularly because the disclosure element is by far the most difficult. The framework we have developed, which is based on our experience of what really works, is to help the victim work through the 5 elements in the order that they find the most natural to them, hence the term unstructured. The conventional approach, offered by counsellors and therapists, is usually to start with disclosure, asking the victim to describe what they have been through. In our view, this is both harmful and unproductive, as it presumes a level of understanding that the victim, and often the counsellor, simply do not have, usually ending with the victim either not wanting to continue therapy or believing that nothing will really help them. Our approach begins with what we call reverse disclosure, where we tell the victims that they do not need to tell us what happened to them, as we already know, because it happened to us. To reinforce this, we then tell the victim what we went through, using terms and details that we know they will recognise. This has a very powerful effect on the victim, who feels a significant sense of relief, coupled with an immediate peer bond, which establishes the trust necessary to allow the process to progress. We then deal with the next element, which is understanding. By introducing them to a survival guide we've written called Picking Up the Pieces, we are able to describe exactly what sexual abuse is, how it impacts on the development of the individual, the coping strategies victims employ, and the psychological and emotional problems that develop later in life. The guide also deals with the many myths about sexual abuse, such as do victims of abuse go on to abuse others, and includes the testimonies of some 70 other victims, the purpose of which is to show the victim that they are not alone, nor is their experience unique, information that we know breaks the terrible isolation all victims feel. Once we have talked briefly through the guide together, we encourage the person to start to think of themselves as survivors rather than victims, which is in itself an important positive step towards breaking the victim mentality. We then give them a copy of the guide and suggest that they read through it again at home over time, either alone or with someone they can trust, and then contact us again, when we will answer the many new questions they will have from reading the guide, and begin working towards the next element of the process, which we call acknowledgement. In the next film, we will look at what we mean by acknowledgement and what it involves, which includes an explanation of how the criminal and civil justice system works in respect of victims of childhood sexual abuse. If you would like a copy of the guide, you can order it through our website.